Good evening, everyone. My name is Sabrina Epstein. I use she, her pronouns, and I work here at Disability Rights California as a policy analyst. Tonight, we are going to be presenting on Medicaid changes, Part 1, state and federal policy updates for Californians with disabilities. For a visual description, I'm a white woman with short curly hair and glasses, and I have a pink sweater on and a Halloween virtual background behind me. Our slide has a clip art graphic of a group of disabled people along with the logo of Disability Rights California. This presentation will be recorded, and we will share the slides with participants after, as well as the recording. As Harvey said, we will answer questions at the end of the slideshow. And for accessibility, we're going to minimize responding to questions in the chat, and all of our slides will have visual descriptions if there's any graphics on them, but most of them are just text, so you'll get all the content. So this evening for our agenda, we're hoping to answer several questions for you about Medicaid and the changes that are coming over the next few years. We're hoping to help you answer, will these changes affect me or my family member? And how can I plan for them? What other changes could be on the horizon? And how can my voice be heard if I have concerns about these changes? So to answer those questions, this is our agenda. First, we're going to do an overview of disability and Medicaid, highlighting key terms that you'll need to know in order to understand the different changes. Then we'll talk about why the changes are happening. From there, we're going to talk about what we already know, which is what changes you can expect, who they will impact, and when they will occur. Then we're going to talk about what's at risk in the 2026 state budget, and we'll conclude with questions. Now I'm going to pass it to my colleague, Anna.
Thank you, Sabrina. Sorry, folks, it wouldn't let me unmute myself. Well, good evening, everyone. And again, thank you for joining us. My name is Anna Leach Proffer. I use she, her pronouns, and I am the managing attorney for our healthcare practice group here at Disability Rights California. For a visual description, I am a white woman with long, light brown hair, and I have on a white and blue striped button-down shirt this evening. So first, I'm going to discuss a few basics about Medi-Cal, California's Medicaid program, with the goal, as Sabrina said, of helping you determine which, if any, of the changes we discuss will apply to you or your family member. So many people with disabilities receive Medicaid. So Medicaid is called Medi-Cal in California. Different states have different names for their programs. What Medi-Cal is health coverage that allows individuals with disabilities to access health care and home and community-based services. So the services include things like long-term care, also includes in-home supportive services, or IHSS, a program that many people know well. It also includes things like dental services, doctor's appointments, access to medical supplies, and what we call durable medical equipment, things like wheelchairs, shower chairs, that type of thing. Also covers medically necessary surgeries, hospitalizations, and much more. So what Medi-Cal provides is essentially comprehensive healthcare coverage. Next slide, please. Okay, so next I'm going to talk about the different ways that a person can qualify for Medi-Cal, because there are many different ways that you can qualify for Medi-Cal. It could be based on your disability, it could be based on your income, or in some cases, a combination of both. And this is important because many of the changes that Sabrina and I are going to be discussing later will only apply to people with specific types of Medi-Cal. So we want people to kind of know what the types are and then be able to know which things impact, may impact you or your family member. Next slide. So when someone applies for Medi-Cal, it's typically the determination about whether you're eligible is made by the county that you live in, county's Medi-Cal office. So when the county determines whether someone is eligible for Medi-Cal, they first look at whether you automatically qualify based on receiving other benefits. So examples of that are if you receive SSI or supplemental security income or CalWorks, you're automatically eligible for Medi-Cal. If a person does not receive one of those two benefits, the county will then evaluate your eligibility under a program that's called Modified Adjusted Gross Income Medi-Cal. People often refer to that as MAGI, MAGI, Medi-Cal. So essentially what this is just Medi-Cal eligibility based on your income as reported on your federal taxes. So there are different income limits under this program for adults and children. The income limits also vary by household size. So more members in the household, there's a higher income limit. Just as an example, for a single adult, the limit is 138% of the federal poverty level, which is about $1,800 a month. So this will be the population that is going to be impacted by a lot of the changes that we're talking about later, including work requirements and more frequent eligibility determinations. So the impacted population there is going to be sort of a subset of this population, which is referred to again, and I apologize, there's so many acronyms in this work that we do, but this is the Affordable Care Act, or ACA, Adult Expansion Group. So next slide. There are also a number of disability-based programs for Medi-Cal eligibility. I'm not going to go into details about these programs, but just going to name a few of them. So there's a PICKLE program, the Disabled Adult Child program. So that is for people, individuals who receive SSDI on the account of a retired or deceased parent. There's also the 250% Working Disabled program. And then there's the Aged, Blind, and Disabled Federal Poverty Level program and the Medically Needy program. Next slide, please, Sabrina. Okay, so next we're going to talk a little bit in more detail about the ACA Adult Expansion Group. This is the group most impacted by the upcoming changes. So just for a little bit of history, prior to the passage of the Affordable Care Act in 2014, non-disabled adults without dependent children were generally not eligible for Medicaid. After this expansion, the now expanded eligibility to most individuals age 19 through 65 with incomes below, again, the 130% of the federal poverty level, about $1,800. And this group eligibility is based on income alone, which means they don't go through a disability determination to become eligible. Next slide. Okay, so now the important part. I'm going to give some information about how you can determine which Medi-Cal program you are in, because you're going to need to know that to know which of the changes that Sabrina and I are going to discuss later apply to you. So The most direct way is to call your county Medi-Cal office, ask them to tell you what program you are in and your aid code. They should be able to tell you both of those things. You can also contact the Medi-Cal customer service line. We have the number there in our slide and ask for your aid code. Once you have that aid code, you can look it up using the chart that we've linked to. And I will, as soon as I'm done with my slides, I can drop that in the chat too, as well, so people can have that link in a variety of ways. Um, so because there are only certain aid codes that will be impacted by a lot of these changes, the aid code that you're going to be looking for is M1. So that's the aid code for the ACA Adult Expansion Group. If you are in that group, you're going to be impacted by many of these changes. Just to try to make this a little bit easier, if you are likely not aid code M1 if you or your family member that you're concerned about receive SSI, receive disabled adult child benefits, if you have Medicare, or if you don't file taxes. But again, those are just sort of general rules. The best way to know for sure is to contact the county or the state to determine your aid code. Next slide. So another key term that we want to discuss early in the presentation is the term unsatisfactory immigration status. That term is important because many of the changes that occurred as a result of the state budget, in particular, impact only individuals in this group. I do want to make sure to say first that DRC does not have expertise in immigration issues, and that anyone with specific questions about their immigration status should contact an immigration attorney. We're providing this general information to help people determine if they may be impacted and want to seek additional information. So unsatisfactory immigration status, which in some of the documentation, some of the information is abbreviated as UIS, is a new term that's being used by the Department of Healthcare Services. It's the agency in California that administers the Medi-Cal program. So DHCS considers a person to have unsatisfactory immigration status if they, and this is a quote, do not claim or cannot verify one of the recognized immigration statuses that qualify for federally funded full coverage. So examples of status that are considered unsatisfactory include you have deferred action for childhood arrival status or DACA status. You are in the US on a visitor visa, student visa, or temporary work visa, unless you are under 21. You are a green card holder who is not exempt from or has not met the 5-year ban or 5-year waiting period requirement. You have applied for a U visa, but it has not yet been granted, or you were paroled into the US for less than 1 year. So that just sort of the most recent information we have from the Department of Healthcare Services on how how the decision will be made to determine if someone has unsatisfactory immigration status. So I am going to turn it back over to Sabrina now to talk about some of the changes.
So now I'm going to talk about why these changes are happening. There are two sets of policy changes affecting Medi-Cal in the coming years. The first, and this is under an icon that shows a map of California, is the state budget, which was negotiated by the state legislature, that is the Assembly and the Senate, and signed into law by Governor Newsom in June of 2025. Originally, the proposed state budget contained some bigger cuts that you might have heard about, like restrictions on IHSS overtime. But due to a lot of successful advocacy, those cuts did not pass. On the other hand, we have the federal changes from HR 1, which stands for House Resolution 1. You might have heard this called the One Big Beautiful Bill Act, or OBBBA. This was negotiated by Congress and signed into law by President Trump in July 2025. And this contains almost $1 trillion in cuts to Medicaid over a 10-year period. So that's the why behind these policy changes. What we know now is that most of these changes from those two laws are not specific to people with disabilities. However, people with disabilities are part of many different groups, including the adult ACA expansion group and people with unsatisfactory immigration status. So we will go over the changes that affect those groups. You can expect many communications from the Department of Healthcare Services, or DHCS, over the next year about Medi-Cal. We recommend that you keep up with notices and stay in touch with your county Medi-Cal office in order to make sure that you don't miss any opportunities to maintain your eligibility. So now we're going to go over some of the concrete changes that you can expect and who they will affect. So first is the asset limit. And at the top of the slide, there is a timeline, and it says January 1st, 2026 with a star on it. This policy is going to affect people who receive Medi-Cal through the older adults or disability eligibility pathways. If you receive Medi-Cal based on your income through the Affordable Care Act Adult Expansion Group, this does not affect you. For the group that it does affect, there will be an asset limit of $130,000 for a household of one person, with an additional $65,000 for each other person in your household. One car and the house that you live in do not count towards this limit, hence the car and house graphic on the slide. And if you go above the asset limit, you will no longer get Medi-Cal until you spend down under the limit.
Sabrina, this is the ASL interpreter. Can you slow down for me some?
Absolutely, thank you. So this policy change is because of the state budget. Next, we're going to talk about the enrollment freeze for adults with unsatisfactory immigration status. That's a lot of jargony terms all in one, so I'm going to try my best to explain it. But this starts on January 1st of 2026, and this is for new Medi-Cal applicants who have unsatisfactory immigration status will not be able to get newly enrolled in Medi-Cal. So if you are already on Medi-Cal, you can stay on it no matter your immigration status. If you're pregnant or a child, you can still get on Medi-Cal no matter your immigration status. But after the state, adults with unsatisfactory immigration status will only be able to get restricted scope Medi-Cal. So only emergency and pregnancy related services. This is because of the state budget. The next change we're going to talk about is also because of the state budget and related to those with unsatisfactory immigration status. There will be dental coverage changes for those who are considered UIS, unsatisfactory immigration status. They will lose access to non-emergency dental services on July 1st of 2026. But you can still get emergency dental services if you're on Medi-Cal, regardless of your immigration status. The next change I'm going to talk about is eligibility changes for certain immigrant groups that take effect on October 1st of 2026. So this is different than the group that California has determined to have unsatisfactory immigration status, because this is a federal change from HR 1. This group is certain legally residing immigrants who are here under different humanitarian immigration categories. such as refugees and asylees. For that group, they will no longer qualify for federally funded full scope Medicaid. But right now, we think that they will likely still qualify for state-only Medi-Cal. So that means that this group will not be locked out of newly applying for Medicaid. And when they do get Medicaid, they will have access to state-funded Medicaid, which will have the limitations on dental services that I talked about in the previous slide, and a $30 premium that we're going to talk about in a future slide. So again, this is a different group, and this is because of the federal HR 1. I'm going to pass it to Anna now to go over the rest of the changes.
Great. Thanks, Sabrina. Okay, the next change we're going to discuss is a move to more frequent eligibility redeterminations. This change will take place January 1st, 2027, and it will impact the ACA adult expansion population. What this change means is that this group will need to go through the redetermination process every 6 months instead of every year as is currently done. And this change is as a result of HR 1, the federal budget bill. Next slide. Okay, so the next change is a change to the limits on retroactive coverage. So this change also takes effect January 1st, 2027, and it impacts everyone who has Medi-Cal. So current rules allow for retroactive coverage of up to 3 months. So that means that when an individual applies for Medi-Cal, Medi-Cal will go back in time and pay for medical treatment that was that was received in the 3 months prior to the application. But now, as of January 1st, 2027, the retroactive coverage period will change to 1 month for individuals in the ACA adult expansion population and 2 months for all other populations. So that would include children, older adults, people who qualify based on disability. They would be eligible for 2 months of retroactive coverage instead of the 3 that they're currently eligible for. Again, the reason for this change is the federal budget bill, HR 1. Next slide. Okay, so this next one impacts only the ACA adult Medicaid expansion population. Again, starts January 1st, 2027, although it is possible that there will be an extension of that start date. And this is a work or community engagement requirement for the adult Medicaid population, Medicaid expansion population. So what this means is that people in this group will have to report at least 80 hours a month of work or community engagement. So community engagement would include volunteering, it can also include attending school. So this will be required to report that's 80 hours of work to continue eligibility for Medicaid. And the verification will be required at the time you apply, and then again at every 6-month redetermination. Again, this change is a result of the federal budget. All right, next slide. Okay, so this slide talks about a change that will take effect July 1st, 2027, and that will be the implementation of $30 monthly premiums for adults with unsatisfactory immigration status. So this might be a little confusing because as Sabrina just talked about earlier, there's going to be a freeze of new enrollments of individuals with unsatisfactory immigration status. But for the individuals who are already enrolled in Medi-Cal and or are enrolled by the end of this year and are therefore able to keep their Medi-Cal eligibility starting in July of 2027, those individuals in this group will need to pay a $30 per month premium to keep their Medi-Cal benefits. And then if that premium is not paid for 3 months, the individual will lose their full scope Medi-Cal. And because of the freeze, would then not be able to re-enroll and would only have access to emergency Medi-Cal, which has very limited coverage. So this change is a result of the state budget process. Next slide. Great. Okay, so the last change we're going to discuss is the implementation of copays for certain Medicaid, in our case, Medi-Cal services. So currently there are no copays for any Medi-Cal services. What this change would mean is that starting October 1st of 2028, individuals in the adult Medicaid expansion population who make over 100% of the federal poverty level. So it's not all people in the ACA adult Medicaid expansion population. It's going to be those who make between 100% of the federal poverty level and 138% of the poverty level. So a somewhat narrow group. But these individuals will, starting in October of 2028, to pay a copay of up to $35 for certain Medicaid services. We do not know yet exactly what services will be included, but we do know that primary care, mental health services, and substance use disorder services will not have a copay. And this change is a result of the federal budget bill. Okay, so I will turn it back over to Sabrina, who's going to talk a little bit about state budget expectations.
Thanks, Anna. So before we move into questions, we're going to talk about the California state budget. And this is about the 2026 state budget. So these changes have not happened yet, but our current slide shows a pie chart that says federal funds make up over 1/3 of California's state budget. And it says federal funds equals $174 billion, and state funds equals $321 billion. So out of those federal funds, which are about 1/3 of the state budget, we're expecting that California is going to get about $30 billion less in federal funding each year due to HR 1. So that is a huge amount of money that the state is no longer going to be getting from the federal government to make up our overall state budget. Now, why is that important? Well, HR 1 limits California's ability to pay for Medi-Cal through a bunch of different policies. That includes limits to provider taxes, changes to state-directed payments, decreases to reimbursement for certain emergency services, and changes to eligibility for immigrant groups. All of these different policies either mean the state is going to get less money from the federal government, or the state has a harder time generating money to pay for its side of Medicaid, because usually the state and the federal government pay for Medicaid together. So with less money to spend on Medi-Cal, the state has two choices, and they're the same two choices as anyone does in a tough budget. You can either raise the revenue, make more money, or you can cut spending. So this slide says 2026 California budget expectations, and it has a picture of the state legislature meeting on it. The state budget process starts in January 2026 when the governor will propose his budget. From there, the legislature and the governor's office negotiate the budget and finalize it in June. If you have priorities that you want to make sure are protected, now is a good time to reach out to your state senator and your assembly member in order to voice your thoughts. So if you're worried about the cuts that you've heard about so far, or if you have services that are really important to you that you want to make sure are not cut, you should reach out to the people who represent you. But we really want to emphasize today that you should not be experiencing cuts to your services yet. Budget cuts might happen, but your services haven't been cut yet. If you're being told that your services are being cut, please reach out to DRC. There have not been changes in the law to services like IHSS, regional center services, including social recreation, CalAIM, and mental health services. So those things have not had direct cuts. The law around them has not changed. But we are aware of some indirect cuts that are coming because of HR 1, and some examples include specialty care clinics and layoffs at children's hospitals because there's less money in Medicaid spending. One more slide. If California does propose cuts, then they are likely to come between January and May 2026 as part of the proposed state budget. And there's a picture of the state capitol on this slide. The summaries of the major proposals would be announced in January or February, and there's specific details that come out afterwards in something called trailer bill language. There will be opportunities to advocate and push back during this time period, and you should keep an eye out for legislative hearings, town halls, and opportunities to submit letters. Any proposed cuts that are ultimately enacted into law will not go into effect until July 2026 at the earliest.